Hi, thanks for time to given to me. Let me introduce myself. My name is Traviana Nilda Salus. My call name is Nilda. I am from Nursing Study Program. I will reading on and educating patients about their medications, the potential and limitations of writing drug information. Drug information on labels and insert is a major source of knowledge for patients as they attempt to balance the risks and benefits of drugs and administer them safely. Yet this information is often inconsistent, incomplete, and difficult for patients to read and understand. We reviewed the numerous sources of writing prescription drug information, the regulations that govern their content and format, and the lack of oversight in the process and the histories that led to this system. We suggest that oversights and standards are needed so that writing drug information can serve as a correct and organized system to educate patients, to make thoughtful decisions about using medications and to take them safely and appropriately. Patients must have a basic understanding about the risks and benefits of their prescribed drugs and how to administer them. Recent safety problems associated with commonly prescribed and aggressively advertised medications such as the COX-2 inhibitors and antidepressants have increased awareness about the importance of considering medications risks. In its 2006 report, Preventing Medication Errors, the Institute of Medicine's highlighted the pervasive problems of poor medication safety. Ideally, patients should receive counseling about risks, benefits, and safe administration of medications from their physicians and pharmacists. Surveys indicate that most patients prefer to receive these information from their physicians as learned intermediaries. However, there is considerable evidence that such discussions occur infrequently and are often quite limited. A recent study evaluated audio-taped office visits and found major shortfalls in the quality of information communicated to patients about their prescribed medicines. Physicians explained adverse effects and durations of therapy in only about a third of the discussions and provided patients with instructions for use in only 55% of the discussions. Communications with pharmacists is also inadequate. As a result, many patients rely on written information, either on labels or in package insert. The next, I will explain imperative sentence along with examples. Use imperative sentence. Imperative sentence is used to give instructions. There are two kinds of imperative sentence: positive imperative and negative imperative. The first, positive imperative, used for giving positive instructions, part form and the beginning of sentence. Examples: Number 1, please take these medicines 3 times a day. Number 2, please drink the medicines after eating. Number 3, please on your mouth. Number 4, please wash your hand before eating. Number 5, please come to the hospital for control twice a month. Number 6, please take the medicines according to the doctor prescription. The second, negative imperative, used for negative instruction. Examples: number 1, do not smoking in the hospital. Number 2, do not take medications more than 3 times a day. Number 3, do not do a lot of activities because you haven't full recovered. Number 4, don't scream. Number 5, do not take the medicine in face of infection. Number 6, don't forget to check the patients every 2 hours. The next part, writing. Number 1, take medications regularly. Number 2, don't consume a lot of salt. Number 3, don't worship your age. Number 4, do not drink alcoholic beverages. Number 5, go to Dr. Ronald Clinic now. Thank you.